When you open up your Clarius Ultrasound app, this is the screen that pops up after the ultrasound has connected to your tablet or smartphone. At the top, you can see the bar that says abdominal small animals. So what you're going to do before you start is tap that top bar, and then it shows all of the different settings that you can choose. So if you're going to do a cystocentesis or take a look at the bladder, you would select bladder. If you need to calculate gestational age, you're going to select the OB setting. So you just select what best suits whatever it is that you are about to scan. So I am going to select small animal for the purpose of this demonstration. Now that we have our settings, I'm going to show you how to change the depth and adjust the gain. Okay, so we're going to put our probe on the animal. And now that we have an image up on the screen, you can see on the right-hand side that it has all of those dots and then the 5 centimeters. So 5 centimeters is currently the depth that we are at. If you would like to change the depth, just slide your finger and it'll adjust the depth for you. So you can move that up and down anywhere on the screen. If you would like to change the brightness or the darkness, which is also called the gain, you can do a right to left swiping motion, and this will adjust that for you. If you would like further control, there is an orange A on the left-hand side. Tap that, and now we've turned off auto gain and we have full control over our gain settings. So now we can control our near field, our far field, and overall. And to put auto gain back on, just click on the A again. If you would like to zoom in, it's just a pinching motion. So you start with your fingers in the center and then open up, and then you can zoom and then go back out. If you need to freeze the image, you see the little orange snowflake at the bottom, select that, and now you can add your annotation or your measurements, whatever you need to do with the image at this time. So on the bottom left-hand side, there is a pencil that's crossed with a ruler. We are going to select that for our measurement tools. Here you can add your annotations, which is your labels. You can select something from the pre-populated list, or you can type your own and then hit check mark. That puts it on the screen, and you can move this around just by dragging it with your finger. If you would like to get rid of it, you can hit the garbage can and it's gone. I'm going to do that again. So at the bottom, measurement tools, annotate, check mark. And if I tap on it, you'll see the little pin. So we're gonna hold down that pin and pull it. So now you can see that you have a yellow arrow pointing at the structure that you're interested in. Now we're going to do some measurements. So back to the measurement tools at the bottom left. And here you can see we can do volume, distance, trace, multi-distance, angle. You have all of these options. So I'm going to select distance. And it's just a tap and a tap. And those aren't stuck. You can move them around. And then at the top, you can see that we have a measurement of 10.79 millimeters. If you like the way this looks, you can see on the right-hand side, there's a flashing camera. Tap that, and it'll take a picture and save that to the patient profile. In order to keep scanning, just hit the snowflake, and now it is no longer frozen. So on the bottom right-hand side, you will see that there is also a video reel, also called a Cineloop. If we just hold our finger down there, you can see how long of a video you can take. It can be anywhere from 1 second to 30 seconds. So I'm going to hold my finger down on it again, select 3 seconds. I have to tap it one more time in order to start the video. So let's tap it, and then you'll see the countdown. After the 3 seconds is up, it saves that video to the patient profile. Now we're going to take a look at the different imaging modes. So if you hit the B, you'll see there's B mode, M mode, color Doppler, power Doppler, pulse wave Doppler. You have all of these imaging modes that you can use with your patients. So let's select M mode. Here you can drag the line to the area of interest to show movement. With color Doppler, you can also move this around to your area of interest. Let's go back to B mode. And then I'm going to select the B again. So you'll see that there are split screens. So you can have one screen, you can have two screens, you can even have 4 screens. So if you need to compare side by side of your images, this is a good way to do it. And if you accidentally press the 4 screens and you just want one, just go back to 1. So back to that B mode. If you long press on any of these buttons, it'll actually pop up the label for that. So now we know that eco is actually eco mode. Manual focus, penetration mode, virtual phased array, a center line, full screen, chroma for cardiology, and high definition zoom. So let's take a look at virtual phased array. If you need to get between the ribs or look at a structure that's in between somewhere tight, just click on that and it'll automatically change that view for you. To turn it off, just click it off again. Penetration mode. This is going to allow you to have better clarity for really deep down depths. And then focus, manual focus just allows you to see things a little bit more clearly in a certain part of your field of view. Okay, so if we tap the top left, then here we have our patient profile. If you are going to be connecting to your DICOM system, you are going to use the same patient ID that is also found in your DICOM software. So whether that's through IDEX or Antec or wherever else you get your digital x-ray, this is where you would put the patient ID, and it has to be the same so that they connect to each other. And so this profile here, it can be filled out before or after the exam. It's up to you. However, if you do have a pregnant animal, you do need to select female and the species prior to the ultrasound so that the measurements for the fetus are accurate and they're specific to either the canine or the feline. So if we scroll all the way down, we'll have all of our images. If we don't like something, we can hit the garbage can and delete it. Here you can also add notes if you like. Hit end exam, and then this is where you decide where it's going to be saved. So you can save it to your Clarius cloud, which is recommended. If you would like to send it to a reviewer, you can send it here. If you want to save it to your local device, which is your tablet or your smartphone, you will choose JPEG, local device. If you want to save it as a DICOM image, you will select DICOM. And then if you want to save a PDF report, you can check off the PDF report. And once you're done, you just hit end exam. Okay, so now we are going to look in our Clarius cloud to look at our completed exams. So top left, hit My Clarius, And now we have our Clarius Cloud account. So we can hit exams, top right. And this is where you will find all of your completed exams. So we'll just click on the first one here. If you would like to send it to someone, click on Add Reviewers, and this is where you will just put in the email address of where it needs to be sent off to. So whether that's an internist or radiologist, if it needs to go to your clinic's email, so you can save it to the patient file there. You can put this information in here and it'll automatically go to that email so it can be downloaded. If you need to edit the PDF report, just click it there. If you need to add any annotations, if you didn't get a chance to add your labels or your measurements during the exam, you can do that here. You can even edit your images. So everything can be done after the fact, especially if you have a difficult patient. And that is how you navigate the Clarius Ultrasound app and access your finalized exams. Thank you for watching.